Although it seems like the flu and cold season is on its way out, the virus is still active and flu shots are still available. Joining us this morning from Gundersen Lutheran is Bridget Pfaff. Good morning, Bridget.
Good morning, Amy.
You know, as a parent and as just a resident here, we think of the flu more being bad in the fall, and we're past that. So why do folks still need to be vaccinated?
Well, there's certainly been a lot of illness circulating in the community, but that illness hasn't really been influenza yet. Our reports from the state of Wisconsin show sporadic activity throughout the state. So what we can expect after families have gathered for the holidays is likely some transmission of the real flu bug in our community.
Do we ever see flu outbreaks in the late winter or even in the spring?
Well, typically our influenza peaks for true influenza are in the end of January and really into February.
Okay, that is actually right around the corner. So if you get a flu shot today, will it protect you in time?
Yes, you're going to have protection within a couple of weeks, and if you haven't had the flu yet, really, it is still a great time to get your flu shot. You can contact any of your healthcare providers here at Gundersen Lutheran to obtain that shot.
Okay, now people that don't get vaccinated for a number of reasons, but one I hear often is, well, I got the flu anyway, and so it wouldn't have mattered. But there is a difference between what we call the flu and influenza. Can you explain that for us?
Well, a lot of people say I have the flu, and really they're talking about a GI upset, a vomiting disease. True influenza, people say, I feel like I've been hit by a Mack truck. They have upper respiratory symptoms, high fevers, kind of in bed for a whole week. And not a lot of people can afford to take a whole week off of work. So preventing that by a simple vaccination really is key.
Okay, and you can still do that. A lot of those flu clinics now over, so where do I get this vaccine?
Again, contacting any healthcare provider, your general practitioners' offices will have that here at Gundersen Lutheran.
Okay, and it protects not only against influenza, but also the H1N1 virus?
The H1N1 virus is in there. As you were talking about looking back earlier in your show, I was thinking about 2009, and we certainly had a different flu season than we're having this year. However, that vaccine does protect against that strain that circulated last year and caused all of the headlines.
Okay, so could peak here end of January, February, so go get vaccinated today.
Correct. It's not too late. Our activity in the state is only sporadic, and we can still see protection.
All right, and we hope it stays sporadic.
Yes.
All right, thank you, Bridget Pfaff from Gundersen Lutheran.